Hi, my name is Melissa Szynski, and the topic of my speech is hospice. For me, hospice is a word that means support, compassion, and understanding. My grandmother was diagnosed with terminal cancer in 2003. My husband and I were told by doctors that she would only make it 6 months. My family wanted to put her in a nursing home, but we knew that's not what she wanted. She wanted to die in the comfort of her home, surrounded by her family. Thanks to hospice, we were able to provide her with the care that she wanted, and we had the support and encouragement of the hospice volunteers through the hard process. My father was also diagnosed with bone cancer in 2012, and with the support of hospice, he was able to have his last days surrounded by family and friends in the comfort of his own home. Hospice changed both my family members' lives and our lives, as they provided such compassion towards them and supported the whole family even long after they had passed. What is hospice? The word hospice means a place of shelter and rest for the weary or ill. According to the National Hospice and Palliative Care Organization, the history of hospice, in 1948, Dr. Dame Cicely Sanders created hospice at St. Christopher's Hospice in London. In 1963, he visited the United States, and at the Yale University, he spoke about hospice care. This was the beginning of the hospice and what we know today. According to WebMD, 2011, hospice care. Hospice is pain management to care for the dying without artificial medical assistance. The services help patients and their families cope with a terminal illness. WebMD states that caregivers mainly come into the patient's home to help keep the patient in a familiar family environment. According to WebMD, the services that are provided to the patient and their families are medical care, pain and system management, access to hospice 24 hours, 7 days a week. They provide medical supplies and equipment, counseling, social support with psychological, emotional, and spiritual support, guidance with issues that might be difficult but are a normal process of life, respite for the family members and caregivers to give the family members a break, volunteers to help with meals, running errands, and support and counseling after loved ones pass. Who is eligible for hospice? WebMD states that patients that have been diagnosed with an incurable condition, and the physician states that life expectancy is 6 months or less. If the patient lives longer, they can still keep hospice. If the patient gets better, they can stop receiving hospice at any time. If you need to go in the hospital, you can still receive hospice. I know what you're thinking. How can I afford this care at home? Medicare and most private insurances pay for hospice. According to WebMD, many hospice programs help patients by researching if they have the coverage for hospice services. Now that you know about hospice and how it can help you or your family member live their last days in the comfort of their own home with loved ones, would you consider hospice? The support you and your family will receive from hospice will help you and your family cope and feel supported during this hard time. I know without the support of hospice, I would have not been able to have my grandmother or my father with me during their final days.